can't hear the applause, you can come louder. Thank you. Please be seated. In Nigeria, the COVID-19 pandemic has spread as rapidly throughout the country as it spread around the world, leaving footprints of an illness affecting the economy and the whole of society, with debilitating effect on some countries and systems. There is no doubt that these have been trying times for humanity, for all countries, and also for every Nigerian. Despite the challenges, there is now hope of relief with the introduction of the much-awaited COVID-19 vaccine. Vaccination with safe and effective vaccines against COVID-19 is a critical part of Nigeria's strategy to counter the pandemic and stop transmission of the virus. To this end, several research bodies and pharmaceutical industries have responded to the call to develop a safe and efficacious vaccine against COVID-19, and it has yielded results in record time in various areas of the world. We in Nigeria finally have the privilege of being able to join other countries in kickstarting the immunization program, which will prioritize, first, those people most at risk of infection due to their exposure in the line of duty, those are the frontline health workers, and also those who, if they get infected, are at highest risk of severe disease. All these have been as determined by available epidemiological data. Our goal is to introduce the COVID-19 vaccine in a phased and equitable manner based on advice of the World Health Organization and the experience we have observed other countries to make, and ultimately vaccinating all eligible Nigerians within the next 2 years in order to ensure herd immunity. TEACH, which is TEACH, is an acronym for a 5-point strategy developed by the Vaccination Implementation Arm of the Federal Ministry of Health, which is the National Primary Healthcare Development Agency, out of its many, many years of vaccination implementation experience in Nigeria, and most recently, as has already been said, with the polio eradication initiative. And that acronym translates as follows: T for traditional vaccination campaign approach, E for electronic self-registration by eligible Nigerians, A for assisted electronic registration for eligible Nigerians, C for concomitant vaccination alongside electronic registration, and H for house-to-house electronic registration. This is very well put together. And it is the launching of the TEACH strategy for COVID-19 vaccination and electronic management of immunization data that we are here gathered to perform today as a very important activity to assure Nigerians of our readiness to roll out the COVID-19 vaccination campaign smoothly. I am delighted and privileged to be leading this event as Minister of Health at this time. I assure you that the world is inching closer to gaining control of this pandemic, and with all the emphasis Nigeria, the Ministry of Health, and NPHCDA have placed on the various pillars of our overall response strategy, from community engagement and risk communication, to improving COVID-19 case management, to maintaining routine and essential medical services, to providing more timely physical and eventually financial access to healthcare service during times of personal health emergency, so that we do not leave any Nigerian behind and we do not suffer decline in other areas of healthcare. And now to the access of all eligible Nigerians to COVID-19 vaccine administration. I again commend the National Primary Healthcare Development Agency under the leadership of Dr. Faisal Shuaib and his very hard-working team, who have developed a homegrown strategy to deliver this novel vaccine. The introduction of electronic management and immunization data is critical to addressing challenges we have with integrity and quality data, and ultimately primary healthcare data. Dr. Faisal has very elaborately described this to you and all the benefits that Nigeria will have from the past, and also the benefits that will help us in the future. I therefore urge all stakeholders, partners, subnational governments, corporate organizations to have faith for once in the plan that the government is developing and to align with the initiatives born of years of experience in the immunization space. No private hospital or organization has the experience with handling this type of novel vaccine, and certainly not the experience in vaccine application that NPHCDA has. All questions about the vaccine can be directed to the Ministry of Health and to NPHCDA. But this is not a time to work at cross purposes. It is not a time to be making private or parallel arrangements for vaccine procurement and or vaccine administration. This will only disorganize what has been so carefully planned out and create chaos. Vaccines that are not approved by NAFDAC will be determined as dangerous, and they will be seized by customs and NAFDAC, who are on high alert for illegal vaccine importation. Fake and falsified substandard vaccines are already around in the global illegal market. The federal government is in a position to take care of all the interests of various segments of society and to handle all, I emphasize all, requests and wishes from all areas. We have received requests from foreign embassies and international organizations to be included in the vaccination program, which will be professionally handled. We have also worked very closely with the private sector, and I here want to again join in appreciating COVID, who have offered to support us, not only financially, but also with making the necessary contacts and access to all our desires in the health sector with regard to COVID-19 vaccine acquisition. Nigeria has opened an account with the Afrexim Bank, through which all procurement we make will be paid for. Any corporate organization that wants to support the government effort is invited to consider making that contribution to that account. Government does not need to receive your donation. The Ministry of Health does not need to receive it. MPCA does not need to receive it. The account is there for all those who want to support us. And as I have said, the interests of all organizations can be safely, easily, competently, and professionally accommodated by NPHCDA strategy. In less than 24 hours from now, the first batch of AstraZeneca vaccines will arrive in Nigeria from the COVAX facility and will be deployed to vaccinate first, as I said earlier, the critical frontline health workers who are providing essential care, especially for the severe COVID-19 patients. Next are those who are at high risk of severe disease. Every health worker who gets infected, we have to go into isolation, and that means one more less staff. That is the reason why they are prioritized, because they are exposed. We want to be able to have covered 70% in order to achieve our desired herd immunity. The World Health Organization has advised all countries to limit vaccination for now to persons above 18 years of age until research and studies are completed on any possible effect on growing children of 18 years and below, except such children have severe underlying illnesses where the benefits of vaccination justify the risk. All countries are following this guideline and other global guidelines issued by global authorities, as Nigeria will also do. This is made all the more important by the fact that the target population for our vaccination exercise, we must remember, is not the usual cohort of children that we are used to, but this time adults. As a novel vaccine, NPHCDA has trained vaccinators to be ready for the known and unknown side effects, which will be handled professionally and recorded for knowledge. And let me add here that the government has had to issue what you call an indemnification for these vaccines because they are new. And they should not be handled as if they are regular routine vaccines like tetanus vaccines or other vaccines. They need to be handled centrally, properly governed. As we have been told, TEACH is a hybrid of our traditional vaccination campaign using the microplan and the electronic registration systems seen in advanced countries. The development of this hybrid is commendable, and I'm sure our immunization landscape will be much enhanced by the experience from this exercise. NPHCDA will take advantage of the best available knowledge and skills in the world with regard to the unfolding COVID-19 vaccine space. I urge all eligible Nigerians to take advantage of the COVID-19 vaccination exercises when it is their turn. This is the only way we can achieve our target of herd immunity to stop community transmission of the virus. Well before the 4 million doses we are going to receive, the 4 billion doses of AstraZeneca, well before it is expended, we shall be receiving more vaccines. So there should be no need for anxiety. We shall also be receiving other types of vaccines. And all this will ensure that the entire vaccination administration will be sustained in a smooth way and also will be applied nationwide. No one will be left out, no one will be left behind. I want to thank all our partners who have been working very hard with NPHCDA under the auspices of the COVID-19 Technical Working Group and also the COVID-19 Vaccine Coordination Committee. I urge you all not to rest on your oars until we complete this exercise, which should last 2 years, but which within the next month or two, we go through the initial phase of learning and adaptation of the plans to reality. I am not ruling out the fact that there may be a hitch here or there, but this hitch will not arise as a result of not having tried. There will probably be hitches due to the unknown and unforeseen. But sooner or later, we have a routine, smooth, operational system for the vaccine administration. So we'd like to also here ask that you show understanding if there are any initial unavoidable hitches, as we have seen in every other country in the world, and I have constantly drawn the attention of MPACDA for us to sit down and look at any imaginable gap in our system. And I can say quite clearly that they have responded very well and tried to cover all the gaps that we can see. But since man is not perfect, it's possible that there are still one or two little gaps which will be addressed immediately as they appear. Here, I want to acknowledge and appreciate the critical role the media has played in supporting government in this exercise. Your role is extremely important in passing on accurate information and supportive information, and also in not participating or propagating fake news, false rumors, disinformation, and misinformation that can crop up anywhere. Distinguished ladies and gentlemen, it is my honor and privilege now to hereby officially launch the Teach strategy for COVID-19 vaccination and the electronic management of immunization data system in Nigeria for the health of our people and to the glory of God. Thank you for your attention.